Well, I very much hope that this will be a wake up call to take diabetes more seriously, to work to prevent diabetes and its complications. And ADA has been leading this effort through research, advocacy, education. And the hope is that we are having greater and greater traction. And I think this effort that we alluded to earlier about Medicare reducing the cost of insulin, out-of-pocket cost of insulin for individuals with living with diabetes, is an example of how, in the midst of COVID, there's been greater understanding about the importance of diabetes. And I sincerely hope that that continues at the federal government level, but also nationally and internationally, because this is really a global epidemic that we need to get a handle on. It's a good question. I hope, I'm optimistic that the movement towards telemedicine that has really accelerated as a result of COVID will continue. It's not a replacement for usual care, but it certainly can vastly augment the care that's delivered on site. It's more convenient for people living with diabetes. It allows greater access to providers that may not have individuals may not have access to, and so I hope that we continue to see a proliferation of telemedicine, including a variety of digital health approaches to diabetes that have shown to be efficacious and helpful for people with diabetes. Well, this is a time where there is a lot of challenges facing us as a society, and diabetes continues to be an incredible public health problem that we see coming up in terms of COVID and the morbidity and mortality of people with diabetes with COVID. But even in the absence of COVID, it continues to be a leading cause of blindness, kidney failure, amputation, stroke, and heart disease. And the good news is that working together, we really have a great understanding of ways that we can reduce that burden of diabetes for all of those that live with it.